Is it acceptable when a patient comes in for an E&M that is an auto-liability motor vehicle, but at the end of the visit expresses health-related issues that the physician addresses? Is it okay to bill an E&M code assessed for auto to the liability company, as well as an E&M code to the health insurance for the health problems the same day? The answer is absolutely yes. I have asked this question at least 50 times over the years just to make sure. Some doctors have issues with taking a lot of the information from the first part of the exam and carrying it over and double dipping with the health insurance, and that's really not how it works. And so I wanted to cite an example so that you could have a visual. And it's very similar to a patient coming in for a preventive exam and then talking to the doctor about another problem, and you can bill a preventive with an E&M. Same concept, only we're dealing with two different insurance companies. And I always preface this by saying that I have never run into an issue where it's unethical if the doctor's documentation and the billing is done right. There's always an exception to the rule, so you always want to make sure that if you have any questions to ask the motor vehicle or the health insurance carrier. But let's assume, like an example, that a patient had whiplash from a motor vehicle accident and went to see the doctor. He had to come back a week later, and this is the follow-up visit. And when he first saw the patient, it was just gave him a script, say for Motrin or something like that, and rest, and basically that was it. He comes in for the visit a week later, and the doctor really does a very limited history. He, reviews the elements of the complaint, how's your neck, and so forth, and the review of system related to the injury, and then it's coded at an expanded problem focused. His exam was just, he didn't even take vitals. He looked overall at the appearance of the patient, and he did a single system organ exam, which was the neck and the shoulders, musculoskeletal. There was nothing. The patient had improved. The established problem was improving. There was minimal risk. No other treatment was necessary. And the doctor said, come back, if you have any issues, but everything seems to be going okay. And then when you just throw it all together, it comes up as a level 2 established visit, patient visit. And I mean, this is definitely a synopsis, but he really just came in to check the neck, and that was it. At the end of this visit, I'll go to the next screen, he says, oh, can I talk to you about a problem I have? Because I've had a sore throat for a few days, and I feel like I have a temperature, and he goes, the guy next to me was diagnosed with strep, and I was just wondering if you could check it out. And so now we're talking about a whole different documentation, and the complaint is a sore throat. And so he goes through and he, asks all the questions, does the review of systems, and the nurse comes in and she does the vitals. She takes his temperature, blood pressure, everything that he did not do in the first visit. And then he went and he did the ears, nose, and throat and checked all of that. And when he looked at the throat, he said, I'm going to give you a quick strep test just to make sure, and it came back positive. And based on all the information in the documentation, it came back as a level 3, and he also did a rapid strep test, which was an 87880 with modifier QW, which means clear waved. And that is totally, if you looked at the notes, they're totally different than what he documented for the motor vehicle accident. And really, the scenario could change in any way, because if the visit was much more extensive for the motor vehicle, and then the patient brought up the sore throat, you really have to weigh it out. The one thing they did say, and doctors are I shouldn't say this, but a lot of doctors are notorious for billing like a level 5 for, say, the motor vehicle, taking all that information and dumping it into the E&M visit, and then billing another level 5. If you do everything in one visit, you can document it and bring that forward to bill the health insurance, but you may have to use time as a contributing factor, and you can definitely say in the note that certain things were done for the motor vehicle, but you would probably implement, like I said, the time or counseling, care and of that nature to bring it up to the level of service. It's really based on documentation, but you can't double dip. So you want to make sure that all your information, it can all on the same day, but definitely separate, and you should be fine.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.